Okay, so I went over the patient chart for any significant findings to see if the patient is on any anticoagulants. The patient isn't. I've reviewed the physician order, which calls for an ABG to be done today, which is what I'm going to be doing. I've gathered my necessary equipment, which includes my ABG kit, my specimen bag, my gauze, my syringe, my Band-Aid, my label, my alcohol prep pad, and my gloves, and also some support for the patient's wrist. At this point, I'm going to go ahead and wash my hands and introduce myself to the patient. Hi, my name is Brittany. I'm a respiratory care student. May I have your name and date of birth? All right, great. It matches up with his wristband. At this point, I'm going to go ahead and look and see what type of oxygen the patient is on. He's on a nasal cannula with 3 liters, or 2 liters. The percent is 28%. At this point, I'm going to go ahead and document all that, which is my name, the FiO2, the date, the time, and the temperature, which I can get off the chart, and the room number. Okay, at this point, I'm going to go ahead and ask the patient to do a modified Allen's test, in which I would have the patient lift their arm facing me. I'm going to go ahead and include I'm going to go ahead and ask them to make a fist, and I'm going to include their radial and ulnar arteries. At this point, I will ask them to release the fist, and I'm going to also release the ulnar artery. If the patient's hand returns to pink, red, then I know that the patient has collateral circulation. All right, so now I'm going to go ahead and put on my gloves. All right, I'm going to get my alcohol prep pad. I'm going to wipe the patient's wrists clean and my fingertips. I'm going to go ahead and palpate. Okay. I'll make sure that the alcohol has dried, which it has. Probably take about 10 seconds. Now I'm going to go ahead and with my needle, I'm going to go and bevel up at a 45-degree angle. I'm going to tell the patient first that they're going to feel, a slight pinch. Okay. Feel a slight pinch. Okay, great. Now that I've got my blood, I'm going to go ahead and tap my needle, place my gauze on. I'm going to place the gauze on for about 3 to 5 minutes, applying some pressure. If the patient's on anticoagulants, I would apply pressure for about 10 minutes. Okay, at this point, I'm going to go ahead and put the Band-Aid on the patient. Okay, I'm going to reassess the patient. I would also place my sharps in this sharp container, put my stopper onto the specimen, and make sure the heparin mixes in, and also make sure no air is in the specimen. I will place my specimen in the specimen bag. If it's going to be out for 30 minutes, I would put the specimen on ice. I'm going to go ahead and take my specimen to the proper area where it needs to go, and I'm going to go ahead and do my documentation and clean up my area. And also